Hey everyone, this is Samantha Farley with Type1Tribe, an interview series with T1D leaders all across the world. Today, our guest is Falyn Shilts, a type 1 diabetes healthy lifestyle expert who also lives with type 1 diabetes herself. Thanks so much for being here, Falyn.
Yeah, thanks, Samantha, for having me.
Of course. So tell us a little bit about you. Where do you live? What do you do for work? A little bit about all that.
Yeah, so I live in sunny Florida, in North Florida, in the Jacksonville, St. Augustine area in St. Johns County. We have been here 10 years next month. It will be 10 years. We moved from South Florida. I've had type 1 for 26 years, since I was 14. I'm 40 now. I have 4 healthy kids, thank God, healthy pregnancies. And yeah, I help people just learn how to live a healthy, sustainable life with this disease. Because it's truly possible. And health and wellness has always been a passion of mine, but I kind of fell into marketing after college. And then once I started going to doctors who were specialists with the pregnancy, my first pregnancy, it just opened my eyes, and it made me realize a lot of people don't understand this disease. And even nurses in the offices and in the hospital, they were asking me questions about type 1. They didn't know. And it just really opens my eyes. And I really had to take control of situations for my own health that I don't think a lot of people probably do. And that's when I just became more vocal about it and getting involved with more organizations, different events, and just being more open and sharing my story. And it's really just amazing, just the feedback, like people reaching out saying like, wow, like I did not know that. And thank you for bringing more awareness. And, you can go to a doctor a few times a year, get your prescriptions, check your levels, your A1C. But at the end of the day, this disease is 24/7, as you know. And I was finding just from social media, a lot of people, like whether you're type 1 or type 2, a lot of people were leaving these appointments with a pamphlet and no support. It's a daily challenge for a lot of people. Sorry, my dogs.
Love dogs.
So that's kind of what drove me into this field. And my background's health and wellness leadership, and I always wanted to be in the health field, but just kind of fell into doing my own thing, which I love.
Yeah, that's awesome. And I totally agree with what you said about the doctors not knowing anything. Even when I was diagnosed and had to go to the hospital, the MDs, the actual doctors who came in to tell me about type 1 diabetes, literally didn't even know much. And it's shocking, but yeah. Anyway. So you said you were diagnosed when you were 14. Yes. Can you tell us a little bit about your diagnosis story and what you remember?
Oh my gosh, it was New Year's Eve, 1996. I was on winter break. I was in high school, and my cousins were down from Canada visiting, and we were doing all the things, going to the mall, the movies, the beach, eating candy, just everything. And everywhere we went, I was dying of thirst. I'm like, Mom, I need water. I need water. And I was going to the bathroom a lot. I was wetting my bed. I had all the symptoms. I would be sleeping in car rides, just tired, always falling asleep. But I mean, a biggest thing, well, with the urinating, wetting the bed, but then my clothes, overnight, were falling off me. I was 14. So I was wearing junior size. I would typically wear a size 5 at the time, and zeros. My mom took me shopping because she's like, what's going on? You're losing weight. Let's go buy you new clothes. And zeros were big on me. That's how skinny I was. So my mom thought maybe I had a urinary tract infection. We didn't know what type 1 diabetes was. You hear diabetes, but you don't really know. So it was New Year's Eve, the day of New Year's Eve. And she's like, you know what, let's just go to the doctor just to make sure before the holiday, the weekends. And sure enough, they sent me right to the hospital. they tested my urine, my blood sugar was like 390. And it just kind of came out of nowhere. Like a few months before, my mom remembers that I might have had the flu. So they think the virus, something attacked my pancreas, which we know is very possible to cause and trigger this disease. We're seeing a very high rate of diagnoses now after COVID and everything, which is scary. But yeah, that's it. They sent me to the hospital and spent New Year's Eve in the hospital. And
How many days were you in the hospital?
I think 3 or 4. I don't remember. It's like such a blur. Like I remember, but I don't.
Oh my gosh. And so diabetes doesn't run in your family either?
Nope. Nobody.
Wow, that's crazy. And I'm sure back then, like it was a lot different than it is now, because I was only diagnosed 2 years ago. So it's interesting to hear the differences from then to now.
Yeah. So they put me right on injections and sorry, my dog's barking. Teddy, come here. He always does this when I'm on something. They obviously wouldn't let us leave the hospital until my parents knew how to do an injection, even though I was old enough. I kind of just took this on myself. I mean, my parents helped me at the beginning, but my mom always says, like, you were so good about it. Like, you just knew you had to do it. And you were just such a fast learner and wanted to do everything yourself. But yeah, so you had to be on injections for 2 years before they put you on a pump. They wouldn't let you go on an insulin pump. And CGMs weren't even really a thing. Yeah, it wasn't even a thing yet. So yeah, just pricking your finger, shots. And then when I went to college, I went on the mini med pump. And then a few years, no, maybe like 9, when I moved to Jacksonville, like 10 years ago, I went on Omnipod. And then after my 3rd child was born, I went back to MDI shots. I used the pens. And that was like 7 years ago, almost 7 years ago. I've been on the pens now. And I wear the Libre. Sometimes I wear the Dexcom. It depends how I feel.
Okay. That's interesting. I think you might be the only person I know that has the Libre.
You know what? I really like it. It's simple. It does the job. I don't get skin irritations like I do with the Dexcom. It's more affordable. I have the original one too. Like I was chatting with someone the other day. They're like, you need to upgrade your Libre. I'm like, I don't know. I've used this. It's fine. But I guess the new one, it does give you readings where you don't have to scan your phone, more like the Dexcom.
Okay.
But the new G7, it inserts just like the Freestyle. Like it's the same twist thing, and it's little. I just put the extra skin grip on because I just like an extra layer of protection, because my kids will like knock me and grab me, and I've had them fall off just for like if they rub me the wrong way. So
okay, what is the difference between Dexcom and Libre? Like
so the Dexcom, you can look at your phone and see your numbers, where the Libre, you have to click on the app and scan it. Now, I don't know exactly with the new one. It might be different. I don't have all the information. I'm going to get in my next appointment. I could go online and learn about it, but I just haven't had a chance.
So what are you scanning? The actual
You just put your phone, the top of the phone, up to this. There is also a device it comes with. You could use one or the other. I just always have my phone with me. There is like it's like half the size. It's just the reader. Like if you don't have an iPhone, the Dexcom pairs with like Garmin, different Apple Watches, which I did use it during the marathon.
Okay. Yeah.
But I don't know why I got, like before the marathon and after, I was fine. But a few times after, like I still have these like really bad dry spots. And I had this huge inflamed area on my stomach. And I even tried using like people have said Flonase before, like different things to try to prevent the irritation. It bothered me so bad. Maybe it was the batch, like of the adhesive. I don't know. It was nuts. So I haven't put it on since.
Wow. That's crazy because I never have had any skin reactions to it. So that's interesting. But I also know there's something out there now that you can put on first and then put the patch over it to help with that.
Yes.
I don't know, but
there's a lot out there.
Yeah. And so now you're on MDI.
Yeah, I take Tresiba once a day. I take it in the morning and Novolog as needed.
Mm-hmm.
And, it's simple. It's easy. I'm on the go a lot with the kids. And I did do with the trial with Tandem and the T-Slim, and it was great. But I'm just not used to having to take the time to refill the pump. One weekend we were going to a cheer competition for my kids, and I was like, oh my God, I need to pack backup supplies. What if the pump fails? What if I'm like, I can't deal with this right now. It was just, I don't know, too much. This is just MDI's easy. But I mean, with the pump, you do get a little bit more control, but it just depends, like if I'm very diligent and I remember to inject before I eat something, it does make a big difference. But the Tresiba, for the most part, I rarely have a low. Like it really helps balance me out. Even when I exercise, I don't have lows, which is really nice.
Wow, that is nice. I'm on MDI too, but I get lows all the time. So
really,
yeah.
Do you use Tresiba?
No, I have Humalog and Basaglar.
Okay.
Sorry,
So
Basaglar for my long lasting. Maybe
okay. So we'll have a conversation about this after, but I might want to switch because I've tried others and it was terrible roller coasters for me. And my insurance doesn't cover Tresiba, and I have to fight with them every year because I've tried the others and they do not work. I'm like, it's a roller coaster.
Oh, okay, yeah.
There's a lot of options out there. That's what I tell people all the time. I'm like, do what works for you. Fight for what you need.
My doctor was the one who, like, when I was first diagnosed, just put me on Basaglar and Humalog, and I've just been on it because that's what she gave me. So now I probably should look around and just try other things. All right. So tell us a little bit about your business and what you're doing as a health coach.
Yeah. So FalynShilts.com is my website, and I just do different things for people if they need one-on-one coaching, if they want more of the group coaching, more of an affordable price. And basically, I created Diabetes Lifestyle Academy because I was just finding there's so many people who need help with just like the daily things. Like it's not just your food, your insulin, your exercise, it's the mindset, it's people you surround yourself with, it's food choices, there's options, like there's so much that goes into this that I'm like, gosh, like this is so needed. Just a community where you're provided tools and support at an extremely affordable price. Because if you were to go to a nutritionist one time, it's minimum $150. And then, okay, you might get some help, some guidance, but that's it. You're on your own. You have to go back. It's another $150. And number one, people don't have time to be going to these appointments. People don't want to be going. People want the sense of community and support. And I provide people, if you want, I mean, everybody gets recipes, meal plans, like a plan for 30 days, literally every month. It's something different. And I mean, if you want to follow it, you follow it. If you don't, you don't. But it's just done for you, the guesswork taken out, and real life support. I mean, no means I'm not a doctor or nutritionist, but living with it is way different, as you know, than maybe studying it for a day in medical school. It just is. And
yeah,
it just is. I mean, you can read all you want, but unless you know what a high blood sugar feels like, you don't understand. Right. Unless you have a low when your kids are trying to get to school, like I did this morning, like I totally messed myself up. I gave myself too much insulin for something, but it's trial and error. And this morning I see an arrow going down. Oh man, my daughter's screaming at me to get in the car, and my head's just, the feeling, but unless you know the feeling, you don't understand.
Yeah, you're totally right. Yep.
So I've been like finding over the years on social media, just people, they want to be heard and not scolded for doing something, or questioned, why did you have a low last week?
Mhm.
I don't know. Life happens. This is life with diabetes.
Yeah.
So that's kind of just how I started it. And, over COVID, and I've just been building and doing it more and more. So
That's amazing. And you're totally right about the community. It makes such a difference to have people to talk to that know what you're going through. I mean, even if you have a supportive family, they still don't really get it because they don't have it, like you mentioned. So it's great to just be able to go to somebody to be like, all right, this happened. I don't know why. Like, can you help me?
yeah.
So I think that's great.
Yeah, just sharing different tips, and everybody's different. Everybody's life is different. You use something different than I do, and it's not right or wrong. You just have to do what works for you.
Yeah.
It's the daily support, the struggles. And I think a lot of people that you hear about who die from this, or they don't take care of themselves, it's because they don't have the support and education and knowledge and positivity in their life. It's all negative. That's
Mhm.
what would frustrate me the most when I would go to appointments. It's like, it's so negative. It doesn't have to be like this. And
Yes.
we found it, running the marathon. It's like such a positive thing. It brought us together, and you can do anything you want.
Yeah, and that's a good transition into the marathon. So let's talk a little bit about that. So, was this your first marathon that you ever ran?
It was my first. I have done 2 halves before that.
Okay. What made you want to apply to run the New York City Marathon?
So the last half I did was the Disney Princess half with JDRF. And after that, I felt really good. I was like, this was a challenge, but it wasn't terrible. I feel like I'm ready for a new challenge. And if I don't like have something to work towards, or like a race or something, I just kind of get lazy in a way, like I'll do whatever I need to do. Like for example, I'm doing a 15K March 5th here in Jacksonville, just to like keep me going, like something to work towards. Cause I did stop running after the marathon. My body was just done. But what motivated me is the race was November 4th, 5th, something
Mhm.
like that. 6th,
Yeah,
7th.
one of
Anyway,
those.
I was my 40th birthday was November 18th. So I'm like, how cool would it be to say that I ran a marathon before 40? And I lived in New York City for a few years after college, and I would always watch the race and see these old people and heavy people. And I'm like, gosh, if they could do this, I could do it. And it's just been something that I've been wanting to do, like in my heart, like it's been in the back of my mind. So then I'm part of a type 1 running group. I think you're in it too, on Facebook.
Yeah.
And I think Doug posted about it. And I'm like, I'm going to apply. And he's like, you should apply. And I applied, completely forgot about it. And we were out to dinner with some friends, and the husband is a runner. He's like, does a lot of marathons, triathlons. And he was asking me like what I'm doing, what's going on. And he was talking about some race. I'm like, I applied to New York, because he was doing New York. I'm like, I applied on this charity team. And he's like, really? And it ended up like a few weeks later, I got notice that I got selected. So it was just exciting. And there was nothing like the Beyond Type 1 team. I don't think, like just being with 50 of us all having type 1, it was just incredible. Just incredible.
I agree. It was such a good experience. I loved it. It was awesome.
I wish we had more time together, all of us. I
Yes,
feel like we did another 2 days.
Yes, I was going to say that was my only, not a complaint, but just like I feel like I only talked to you for a second at the actual, you know what I mean? It was hard to connect with everybody, but we need to all get together again soon.
Yes, we will.
What is one piece of advice that you would give to a newly diagnosed person with diabetes?
To someone who's newly diagnosed, I would tell them to just be your own advocate. Learn how certain things affect your body. Not one person is the same. And just be strong because you'll be okay.
Yeah,
You will
I
be
agree.
okay. Don't
Yeah.
let the statistics and the complications scare you. You'll be okay.
Yeah, absolutely.
Take
And
care of yourself. You will be okay.
yes, yeah, that's key, obviously. Make sure you are trying to take care of yourself, and you will be okay. That's awesome. So if people want help with your coaching services, how do they get in touch with you?
Yeah, so I'm in Instagram, I'm Falyn Shilts, Facebook, everything's just my name, FalynShilts.com. I always do some awesome freebies and downloads too, so be sure to sign up on the website. I'm on LinkedIn. I'm not that much on TikTok, but mostly Facebook, Instagram, LinkedIn.
Awesome. What's your handle?
Falyn Shilts, just my
Oh,
name,
perfect.
Falyn.
Okay, awesome. Great. And I'll make sure to include that below. But thanks so much for being here and doing the interview with me, Falyn.
Yeah, thanks for having me.